Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Your eyes may be the window to your soul, but your mouth may be the window to your overall health. What your teeth and gums are saying may surprise you, so you should listen carefully. Today we'll learn about all things dental, from common issues that older folks face to some signs to watch out for. Welcome to this episode of Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Stay tuned. Welcome back. I would like to introduce my first guests on today's show, Dr. Sean Melton and Tammie Jones from Melton Dental. Sean and Tammie, welcome to our show.
Thank you. Thanks for having us.
So let's start with Dr. Melton. What are some common things that happen to a person as they age?
Well, there's a certain amount of wear and tear, that goes on as we age, and in the mouth in particular, things of concern could be either thinning enamel or on the teeth themselves, or loss of the bone that support the teeth.
Okay. And then Tammie, you are a dental hygienist. Mm-hmm. So talk to us about the types of training that you have to receive in order to become one.
Well, before I became a hygienist, I was an assistant and a lab tech for 15 years. But you don't have to do that. There's everything from anatomy, physiology, microbiology, pharmacology, psychology, because you're dealing with people. It's a pretty well-rounded science background.
Very good. Should folks take care of their teeth and their gums any differently as they age?
Just have good oral hygiene all your life. That's always a good thing. Try to brush at least twice a day. Use some kind of floss, tooth picking. Water picks are really good. They're making a comeback. Anything that keeps your inflammation lower is not only good for your mouth, it's good for your heart health also.
Good. So Dr. Melton, should folks see their dentist more often as they age compared to as when they're younger?
Well, yeah, patients should probably see their dentist, according to their dentist recommendations by their individual needs for dental conditions or medical conditions. We found that many of our patients that are over 60 benefit by being seen, 3 and even 4 times a year. Just you can keep closer track of any dental conditions that might come up and catch them and treat them earlier. But it also allows us to identify some medical conditions that might come up in a shorter interval and get them referred out for further diagnosis.
Good. So dry mouth. It's my understanding that as we age, we experience dry mouth. Is there anything that people can do to alleviate it? Yeah,
the easiest thing is probably just staying hydrated, getting enough water, and then trying to stay away from any diuretic type drinks like tea, coffee. I kind of lost my train of thought.
So dry mouth is very common, I'm assuming, and it is an issue that I think we all deal with. I know sometimes I will suck on a lozenge, for example. Is that something that helps some people?
It does. There are many over-the-counter products, either oral rinses or sugar-free lozenges that can help alleviate those symptoms.
Very good. Okay. So I'm going to switch to Tammie. And we're going to talk about teeth grinding. So many people grind their teeth at night while they're sleeping. I happen to be one of those. And so what can we do to prevent that? Anything?
Not really is the short answer. You can't really prevent it, but you can mitigate it and you can treat it. A lot more people grind than are even aware. And it's kind of counterintuitive for someone to go, well, I don't grind my teeth, because they're asleep when they do the majority of it. Yeah. But the signs are really unmistakable. You lose tooth surface, you get wear facets, abfractions, and you lose quite a bit of tooth structure, and you can crack teeth more often and then need crowns. So a good night guard is a really, really important if you have that habit. And it's also got more and more, it's coming to be correlated. A lot of people that have sleep apnea, which is becoming diagnosed more often have an accompanying brexing habit. So it's important to get it diagnosed and treat it.
Absolutely. So you mentioned a word there, Brexan habit.
A brexing habit, grinding their teeth.
Ah, okay, very good. So for our viewers, that means grinding your teeth.
Yeah, there's actually two portions of it. You can grind like
Okay.
that,
Okay.
or you can clench, which is more of a movement. Your teeth are set together, and you're doing this.
Very
You're asleep.
good.
You don't know.
That's right. And it also causes, I'm assuming, some headaches and maybe some jaw pain as well.
Tight jaw in the morning, headaches. You do it more in times of stress.
Okay. And then the night guard you mentioned. Do patients have to go to a dentist to get a night guard?
You can try some over-the-counter ones. Some people get some relief from that, but the best one is a custom-made one that's designed for you with impressions in your mouth.
And that's something you would get from
At a
the
dental
dentist.
office, yeah.
Absolutely. So while we're talking to Tammie, can we talk about teeth becoming loose as you age? So in the few moments we have left, can you start off the conversation talking about teeth becoming loose? Is that common?
I don't think teeth become loose as we age. Teeth become loose because there's something wrong. There's an underlying cause, whether it's a disease or a condition, bone loss, periodontal disease. If someone has loose teeth, other than little kids losing teeth and getting their permanent set in, they need to go to the dentist because there's something wrong and they need to get it diagnosed and treated.
Excellent. Well, we're going to have some time after our break to talk more about the loose teeth topic. So thank you for your answers. And as your teeth and gums age, there are some conditions you should be aware of. Stay tuned to learn more about what you should look for. Welcome back to Healthy Living for Life. We're continuing our discussion with Dr. Melton and Tammie Jones from Melton Dental. So, Dr. Melton, before our break, we were talking about bone loss. And I know there is something called periodontal disease.
Yes.
Could you talk to our viewers about this?
Yeah, a common name that people hear is gum disease. And while gum disease is a part of periodontal disease, it's a disease of any of the tissues that surround and support the teeth. A lot of people have a misconception that cavities or root canals or these sorts of things are the most common cause of tooth loss, but it's actually periodontal disease destroying the bone that supports the teeth, and then the teeth are subsequently lost.
Can you talk to our viewers about what smoking and chewing tobacco can do to maybe exacerbate?
Yeah, absolutely. Any use of tobacco decreases the blood flow to the tissues in the mouth, so any insult or injury is going to be that much worse. So either chewing or smoking, they both exacerbate the disease and increase your chance of tooth loss.
And so one of the things that we think about is that gum disease and maybe other things that it might cause. So are there long-term consequences of gum disease?
Yeah, once again, gum disease is a common name, and periodontal disease is the more formal name. And ultimately, it's tooth loss, the loss of the dentition. But also there are other medical conditions that if you don't treat the periodontal disease, it really increases your chance of cardiovascular disease, stroke, and other serious medical conditions.
Wow. So when we were talking about smoking and chewing, we all know that those cause cancer. And as everyone knows, I think, dentists and hygienists can be some of the first to maybe detect this. So Tammie, can you talk about that and what you might look for in someone who smokes or chews tobacco?
Oh, you bet. Whenever you're seeing someone in the chair, you're in their personal space. A lot of times skin cancers are detected in the dental chair. If you're looking in someone's mouth, when you go through hygiene school and dental school, you're trained to look for, there's a wide variation of what is normal. Okay, we're all individuals. But certain spots, like when someone chews chewing tobacco, there's always the tissue inside the lip always gets a strange corrugated appearance. That's one of the first signs that happens. The gums recede. If you have particular speckled areas in the mouth or on the tongue, you're trained to look for that. And it also raises your inflammation level. And Dr. Melton was talking about the periodontal disease having a link to heart disease. When you lose that bone, if you think of your bone as like a zipper, really, really strong, and when you have an infection anywhere in your body, this is another infection. It is a disease. It isn't curable, it's just stabilizable. Okay? If you catch it in time and you treat it and you're seen on a regular basis and you lower your inflammation, which is your level of bacteria in your mouth, that comes from your personal habits and your oral hygiene, you can kind of arrest it, okay? If you have this bone connection, and we all have it, when the infection comes through, it kind of melts the zipper. This is a very simplified version, I'm sure. So here you have totally healthy bone, and then periodontal disease moves in, and say you don't treat it, or you have a lot of the habits that make it worse. Over time, it melts that bone connection. And along with the bone connection, there's a big periodontal ligament. It's the soft tissue connection. Like any infection anywhere in your body, it destroys tissue. So when you no longer have the foundation that your teeth sit in, they fall out, they get loose.
Ah. Great segue into my next question. That was a great example. Dentures. So now my teeth have fallen out because of poor hygiene. Do people have dentures these days?
Oh, yeah, yes, they do. Depending on the situation, the patients that have severe rampant periodontal disease and there's just no other surgical option, then removal of the teeth and placement of dentures, being full or partial plates, are needed to improve their health. There are advances in them, though, especially for the lower teeth, placing implants and having implant-supported dentures to make them much more manageable and a nice option moving forward.
So for those of our viewers who might have dentures, are there tips that you can talk about that help them keep those dentures clean?
Yeah, I'll have to say I'm going to give kind of a personal recommendation. I know a lot of patients that have had dentures for years and years. They used to tell patients to take the plates out at night and soak them overnight, but we really recommend just finding a 15 to 20 minute period during the day to get them out, clean them, disinfect them, get them back in. The reason we don't recommend taking them out at night anymore is that actually can obstruct the airway and cause sleep apnea and other problems. So a 15-20 minute period during the day, get them out, disinfect them, and then back in the mouth.
Wow, so it's kind of a complex thing to think about when you're thinking about dentures. But in the few seconds we have left, getting in to see your dentist, how often? Minimally twice a year, right?
Yes.
And then what other one tip would you give our viewers for healthy gums and teeth?
Probably the single greatest, as far as improving overall health as well as oral health, minimizing liquid sugars, pops, coffee with sugar, and really kind of the trick there would be not so much how much you have, but how frequently. If you have you're sipping on your coffee with sugar all morning, that can be very damaging to the teeth in a very short period of time.
Great, thank you. Stay tuned to learn even more about how dental health can be an indicator to greater health issues occurring elsewhere in our bodies. Welcome back to Healthy Living for Life. I would like to introduce our next guest, Dr. Wordal from Pureview Health Center. Doctor, welcome to our show.
Thank you, Sarah. It's an honor to be here.
So I'd like to talk about tooth implants first.
Sure.
How are they implanted, and how long do they generally last?
Sure. So first, like in an area of like a missing or lost tooth, a dentist will implant a titanium surgical screw into the bone. Typically after that procedure, the area is let to heal for about 6 weeks to a month, and then a lab fabricated crown is attached to that surgical screw to replace the missing tooth. And that can be done with bridges and actually for retention of dentures as well. I think that as long as the home care and preventative maintenance are done on that implant, they can last up to a lifetime.
So I've been told that things that go on in a person's mouth can be a general indicator of health. Mm-hmm. So for example, indicator of osteoporosis or diabetes or even cardiovascular health. Can you talk about that? Is that really correct?
Yes, there's a very strong correlation between oral health and systemic conditions. And it's really important to maintain a good, healthy oral environment to prevent exacerbating, existing conditions or, causing other conditions. I'd say specifically comes to mind is diabetes. Diabetes in general keeps, causes poor wound healing, as well as greater susceptibility to all kinds of infections. So that can relate to dental infections and oral health as well.
So what would a person or a patient look for?
So as far as like systemic issues, red swollen gums, white buildup around teeth, bleeding on brushing or flossing, loose or mobile teeth, I think those are some of the kind of classic signs of issues going on.
So what about dental x-rays? Can they help discover disorders or diseases?
Yeah, absolutely. The main thing with dental x-rays is to, to find decay or cavities, but dental x-rays are an extremely important part of a dental exam in the fact that they can find abscessed or infected teeth, cancerous issues of bone disorders. We get a lot of concern as far as patients with x-rays and the amount of radiation. A majority of that is related to the old kind of film technologies. With kind of the digital technologies that we have today, the radiation is minimal. I'd say it's comparable to wearing, say, like a digital watch or even just taking a flight on a commercial airline. So it's really important that patients, when they come in, that those x-rays are taken and that we can see what's going on.
So anesthesia for dental procedures has come a long way.
Yes.
But what would you tell a patient that maybe had a really bad experience as a child or a young adult, and they're very much afraid of going to their dentist?
Yeah, that's another, I'd say, probably one of the main concerns that we have with patients that come in. Is there's a lot of dental phobia out there, and there is quite a lot of options and related to that. Kind of one of the first things that can be done is, kind of a desensitizing of the dental kind of environment, coming in, talking to the dentist, sitting in the chair, seeing some of the things that are being used, kind of explanations of those procedures. Along with that, there is, the potential for minimal sedation, like just taking a pill, something like Valium or something like that before the appointment, just to kind of alleviate that kind of fear, as well as, we use nitrous oxide, which is, laughing gas, and that's a very, very safe an effective way to kind of, reduce that stress. And the best part about that is at the end of the procedure, the patient leaves without any sort of after effects. They don't have to be chaperoned, and, they can function throughout the rest of the day like in a normal capacity.
I've heard that drinking too much can impact the health of one's mouth. Can you talk about that? How does that happen?
I think anything, more than moderation can, affect health. I mean, and a lot of the same things related to alcohol can be said for smoking and tobacco use as well, which we see a lot of. Drinking it specifically, can cause issues with dry mouth as well as systemic conditions, nutritional deficiencies. A lot of the drinks, alcoholic drinks, specifically like beers and wines, can be acidic, which can erode enamel away. And a lot of things in mixed drinks, some of the mixers and stuff are high in sugar content, which can cause a greater susceptibility to tooth decay.
Yeah. So what about new technologies? Are there some new things out there that our viewers would be interested in learning more about?
Yeah. So, obviously we kind of already touched on, the implant kind of options. A lot of the newer white colored fillings or porcelain crowns can achieve a lot better aesthetic result. However, I would say that a lot of the older technologies, the gold and some of the metal fillings that we have, are still some of the best, dental restorations that we have today. There are things like dental lasers, and there's always technology in dentistry. So, there are a lot of exciting things coming out.
And so teeth whitening and all of that is part of this as well.
Right. Yeah, teeth whitening, I think, is a very popular, kind of deal, and the technology keeps improving with that. And I think that, patients that are interested in that, besides going to the dental office, there are a lot of options, even over the counter, that are very effective in the tooth whitening realm as well.
Excellent. Well, I would like to thank all of our guests on today's show. I hope you learned how to improve your health. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.